Ruth Roemer was an icon in public health. For over 5 decades, she worked tirelessly to promote health, equity, and social justice. While in law school, she competed for the position of editor of a law journal with a fellow student, Milton Roemer, whom she later married. After receiving her law degree, Professor Roemer had the opportunity to work on a landmark project that transformed laws on the admission of patients in psychiatric hospitals. Ruth Roemer found her unique niche at the intersection of law and public health. She joined the Fielding School in the early 1960s, taking up critical health issues as abortion policy, fluoride in public drinking water, and later, discrimination of people with HIV/AIDS. Ruth Roemer created the framework for the World Health Organization International Convention on Tobacco Control. She was an active and beloved faculty member at the Fielding School for more than 40 years, and we are honored that some of her students are here with us tonight. In recognition of Professor Roemer's devotion to her students, proceeds from this event are directed to the Ruth Roemer Fund, which supports student fellowships, field work, research, and other educational activities. Now, I'd like to introduce the Ruth Roemer Social Justice Leadership Award recipient. The award recognizes extraordinary service in protecting and advancing the health and welfare of vulnerable populations. We are proud and honored to present this year's award to a most deserving individual, Supervisor Hilda L. Solis. As supervisor of the 1st District of Los Angeles County, Hilda Solis addresses critical issues of health, including homelessness, environmental justice, healthcare access, improving parks and open space, and many other issues. Supervisor Solis served as Secretary of Labor under President Barack Obama, the first Latina to serve in a presidential cabinet. As a member of Congress, she worked to expand affordable health care, protect the environment, and improve the lives of working families. She authored pioneering environmental justice legislation while a member of the California State Senate. Supervisor Solis became the first woman to receive the John F. Kennedy Profile Encourage Award, the nation's preeminent award for public servants. The career of Supervisor Solis reflects the spirit and goal of social justice. It's an honor to introduce this year's Ruth Roemer Social Justice Leadership Award recipient, Supervisor Hilda L. Solis.
Thank you. Thank you. Muchas gracias. Thank you. Thank you so much for that lovely introduction, Dean. And I want to thank Beth Roemer for being here. What a pleasure to meet you and an honor. Dean and the UCLA, Fielding School of Public Health, and Dr. Fielding, thank you so much for being here. What an honor to see so many delightful friends, and also to the honorees, congratulations to you and to the alumni. And to my sister, Dr. Beatriz Solis, who is an inspiration to me in many ways. And my other sister, Leticia, who accompanies her tonight, they are both Bruins. So if I said, USC, it's because, I beg your pardon, I was the one that went there for 2 years. But I learned a great deal in my travels and growing up in our family. And really am inspired to hear the story of Ruth Roemer. I feel like I know her and would have just loved to have had the opportunity to work and watch her, just peek behind her shoulder to see how much she was able to get done. Much of what her vision was to help protect all of us, the planet, global public health, which is an admirable thing to do, especially these days when those very premises are being picked apart right now. She did something incredible, and that was not only help to teach people, but she was a law professor. She was an advocate for women's rights in the day when perhaps it wasn't appropriate to talk about reproductive rights for women, and also her fight to reduce the consumption of tobacco around the globe. Those are all very, very admirable things that she fought for, and she helps us stand on her foundation that she put forward for all of us. I want to just briefly say that all of us have a better life because of her. We're breathing cleaner air because of her, even though the Lung Association may say that Los Angeles still has a way to go. There was a report issued today about that. But we have made many improvements, and we need to continue to have fighters, warriors, campeones, champions that will help work on behalf of all these issues for those that don't have a voice, in particular the people that I represent in the County of Los Angeles. We have 3.5 million immigrants that live in the County of Los Angeles, and a good portion of them, about 57% of them, speak another language other than English. In fact, there are about 200 different languages that are spoken in LA County. And I would be remiss to tell you that they make up the planet. They make up every ethnic group. They have different religious affiliations, sexual orientation, gender identity, and come from various socioeconomic backgrounds. They each deserve, however, a higher level of care of services that have to align, in my belief, with our cultural background and needs. That's what I believe is continually a challenge for many of us in the healthcare arena and in other parts of our society. That when we deliver services to regardless who it is, that we take time to listen and to understand and to really dive deep into the people that we hope to be a voice for and to advocate for. That is one of the best teaching moments that I have ever had in my life, is to sit back and listen to the diverse and rich cultural individuals that I represent, but more importantly, how I have been able to understand that better at the national level while serving under President Barack Obama. I had a chance to travel around the country and around the planet, and I saw poverty in some of the meanest ways that you could describe. But I also saw in those communities hope and inspiration, and people wanting to have respect and dignity that they should have and should be afforded even to this day. I take the belief that regardless of where you come from, especially in the County of Los Angeles, that you should not be judged by the zip code that you live in, your employment status, your immigration status, and also whether or not you've had access to appropriate health care. And that also there's a need to continue to fight for things that are just for all society, which for me means adequate resources, access to health care, clean air, clean water, nutritious foods, and above all, a healthy and happy environment, no matter where you are. Sadly, I saw many of those inequalities, as I said earlier, around the country. And these individuals that come from underrepresented communities have been overlooked, and they continue to be overlooked in our society, even today as I speak. We have an administration in Washington that would rob these individuals in our communities of their right to have their voices heard and to be represented. Today, on this eve, we're also contemplating whether or not the administration is going to allow for the citizen question to be placed on the census application, which can have a very detrimental effect to the very people that I'm talking about today. And I'm not just talking about status, I'm talking about people who live in poverty. I'm talking about mixed families that may have parents that don't have legal citizenship here, but maybe have children, or maybe have parents, or grandparents, or aunts that live in their mixed households. People are fearful of applying on that application and noting their status. People are afraid to even apply for our healthcare services this very moment because of the issue of public charge, because the administration would somehow say, if you take advantage of nutritional programs, if you take advantage of Head Start programs, that we may come back and charge you with the fact that because you took public funds in this manner, that we may take away your right to stay in this country. Those are very scary and fearful things that are going on right now. And I know Mrs. Roemer would be there fighting right along our side, saying that there is much more that needs to happen to protect those vulnerable populations. And like her, I believe that justice should be made available to everyone. Our Constitution provides that, and not just by way of our voting rights or being accounted for in the census, but also it's my belief that everyone should have an opportunity to have good access to health care and to live in a safe environment. And that's why back in 1999, I worked with my colleagues in the state Senate to pass Senate Bill 115. This was an executive order that President Clinton actually put forward during the time of his administration. It was an executive order. We wanted to see it put in place as law, and we worked for 3 years to get it passed. And at that time, we had a governor, Governor Gray Davis, who actually signed this piece of legislation. It took a long time for it to get through because many people thought it would kill jobs and it would hurt the very people that I thought it would help. And I said, no, everybody needs to have the ability to have clean air, clean water, and a safe environment and safe working places regardless of what zip code you live in. And I was happy that that was signed into law and that it now is somewhat the lay of the land. The implementation part is the hard part, though, to make sure that all our states and other localities implement that law. And we're fighting every day to do that now through some of our cap and trade legislation that's been passed, and thinking also about how to propose funding for projects for housing, for transportation, and where we place people who are homeless. All of those elements go into, in my mind, how we place people in our communities, where they live, where they're situated. And so environmental justice starts at every part of our life and every part of our spectrum. It impacts everyone. And it will continue to, and we have to continue that fight. I was very pleased to be able to receive and was humbled and honored when I got a call from Caroline Kennedy while I was on break, and it was during Easter break. She called and asked if I would be so worthy of accepting an award. And I got that call and I couldn't believe it was her. I said, "You're calling me? Is this really you?" And she said, "I'm calling you because we've selected you to receive this award." And I was so proud. I was so proud because The basis of her leadership at that time, as she took over the realm because her brother had just passed away, was to award someone who had worked on environmental justice and on working class issues and would be the first woman. And she wanted to make that statement. And I just happened to be, in my mind, there. Somehow my name came up. I didn't know anything about this award, but I am so grateful and honored that she gave me that award. And really, the credit goes to my family and my community, because my community helped me push through legislation and gave me the background and knowledge to help pursuing the advocacy that they so much sorely needed. That's who the award really goes to. The people that I represented in the San Gabriel Valley, whether it was fighting the largest waste facility known as the sanitation district in Los Angeles that takes in all the trash for LA County, just fighting to make sure that there was fairness and treatment around the communities that live there. Today, I'm glad to say that that facility is closed, and it will now be a park turned over to Los Angeles County Parks and Recreation Division. But I think the most important area that I am focusing on today deals with, again, contamination in our communities. And it deals with a battery recycling plant that is situated in the city of Vernon. It's known as Exide. It has been there for more than 50 or 60 years, but it was allowed to operate under an expired permit that was made available 33 years ago. There was illegal dumping. The state knew about it, the city of Vernon knew about it, but the residents in the surrounding community didn't know about it. And that's the worst environmental injustice that I can tell you about, because that facility spewed poisonous carcinogens, including lead and arsenic, and radiated from that facility, impacting well over 10,000 households in the area surrounding East Los Angeles and the southeast communities. It's a working class community out there, hardworking people that don't have time even to come and see a doctor or understand quite wisely why their child has developmental disabilities or deformities or hearing problems or asthma problems or high blood pressure or strokes or tumors that somehow are coming about and shown in these families who don't have a history of that. Those are the things that move me, that make me angry, but make me want to move, like Mrs. Roemer, to say that, that this can't happen. And I'm so proud that the county Department of Public Health, and I know we have a representative here in the epidemiologist department in the back there, who reminded me that on one Saturday, back in June of 2017, Dr. Barbara Ferrer and our county put together volunteers, 1,500 county workers and volunteers that went door to door for the first time ever in East Los Angeles and the southeast communities to inform the public about Exide and to ask the very simple questions. How is your health? Is there any pattern of cancer? What illnesses are perceived in your children? How many people have lived here over the course of the years? And let me tell you, we found out quite a bit. And with that information, we were able then to start working on a plan to try to mitigate these circumstances. When I was asked, Hilda, why are you involved in this? I said, because this is our Flint, Michigan, right here in Los Angeles County. And people have to know about it, and we cannot discriminate from providing the kind of help and protection these communities need. There shouldn't be a way of separating who gets justice and who doesn't. I want to tell you, I was moved when I saw a young man come before and testify before the Board of Supervisors. This young man looked as though he was 14 years of age. He was 27 years old. He had numerous tumors. He had spinal issues. he had to have several operations. Just the other day, I saw him. He's still alive. And he's telling me, Supervisor, if it wasn't for your help, I know I wouldn't be here because I got help. I got health care, and I got attention. And I am now serving, he tells me, as a voice to inform his neighbors and people who live in the surrounding area. That, to me, is justice, that we empower our community to be those angels, to inform our community and speak the truth. I'm happy that this year that Governor Gavin Newsom, after hearing about Exide and what's been going on, added another $75 million in his budget. It's the first thing he did as he became governor. Governor Brown put in $176 million, but it has not been exhausted because we still have issues with the Department of Toxics and Substance Control because they're not doing the job that they need to do. That's why the county is involved, trying to do what we can, trying to empower our advocates so that they can do more. So that will go on. But I want to tell you one thing. Homelessness impacts all of us, here at UCLA and at other institutions, K-12 and community colleges. We're finding that there are children and students that are homeless. We're finding elderly women who are homeless. We're finding a record number of people who have just become homeless because they can't afford their rents in Los Angeles. And it is a travesty. We have to work on these issues. One of the things that I'm coming up with, and you may be familiar with this if you've lived here in Los Angeles, the General Hospital. The General Hospital has been now mothballed, I would say, for a number of years. We can't tear it down because it's a historical building. But guess what? We have a new vision and we have new ideas. We want to convert that facility into residential studios, apartments, and what have you, space for people that are coming out of care from our hospital, from our jail, from homelessness, and hopefully can resurrect that building and place up to 700 units of housing for people. I much rather build hospitals and recuperative beds than I would a jail that right now is being proposed in the county of Los Angeles. I've never heard in my lifetime that a 3,800 bed mental health jail could help an individual get well in a jail setting. We have the largest state mental health jail in Atascadero, and their record isn't all that great. I don't know that the county is prepared to do that. I don't want the county to do that. I'd much rather have different community-based, supported, recuperative beds in all places around the county where they're needed, because people don't all come to downtown and have their families there accessing them and visiting with them and the services. It's much better to do it in their communities. So I hope that some of you will join me in that charge, because it is a health issue, it's a mental health issue, and it's an environmental injustice issue. So with that, I want to thank you for giving me this honor, and I want to thank all the faculty, staff, and all the honorees that are here. Congratulations to you for your work, and for the alumni. We have a lot to do, and you have a partner in Los Angeles County and certainly in my office. Thank you very much.
We'll do some. We have time for a few questions. So if you'd like to ask a question.
Well, I would like to say I am very proud of you. You really touched me. You really touched me. You really destroyed my faith in politics. And I believe you. That's really important to me. Thank you so much.
Thank you.
Other questions?
Thank you again. Muchas gracias.
Thank you. So, I would now like to present Supervisor Solis with the Ruth Roemer Social Justice Leadership Award.